All right, so are you ready to totally crush that nurse assistant interview?
I think so.
Because today we're going to deep dive into how to prepare for that interview using RoleCatcher's resources.
That's right. We've got career guides, interview guides, even some AI tools to really help you nail those answers.
I love that.
Hmm.
And, stepping into this field is a pretty smart move because the demand for nurse assistants is growing like crazy.
It really is. There's a lot of opportunity out there.
So first things first, let's paint a picture of what you'd actually be doing on the job.
Okay, so the RoleCatcher Career Guide talks all about that. You're going to be providing that hands-on patient care, feeding, bathing, dressing, helping patients move around safely.
So basically, you're the backbone of making sure patients are comfortable and well taken care of.
Exactly. You got it.
I love it. Now, the guide also talks about the work environment, right? What's it actually like to be a nurse assistant?
Right. It can be pretty physically demanding.
Right.
You're on your feet a lot, working with patients from all different backgrounds. Sometimes things can get a little stressful.
Yeah, I bet. But there's got to be a flip side to that.
Oh, absolutely.
Yeah.
It's also incredibly rewarding. You're making a real difference in people's lives every day.
Okay, so we've got like the basics down. Now let's get strategic.
Yeah.
RoleCatcher has given us a ton of sample interview questions. And I'm so curious to get your expert take on how to approach these.
Let's do it.
Are you ready to dive in?
Absolutely.
All right. So first up, this one seems pretty straightforward. Can you tell us about your experience providing basic patient care, such as bathing, feeding, and assisting with ambulation?
It might seem basic, but don't underestimate this one. They're not just checking boxes. They really want to see if you grasp the core duties of the job.
Right. It's like, do you actually understand what you're getting yourself into?
Exactly.
Right.
And do you have the skills to back it up? So use this as your chance to showcase your experience, make it relevant to this specific role.
So how do you make your answer stand out? Because probably every candidate's going to be saying similar things.
Specificity is key. Don't just list tasks. Bring your experience to life with some really concrete examples.
So instead of just saying, I've assisted patients with bathing, maybe I could describe a specific time. I helped a patient who had limited mobility, outlining the steps I took to make sure they were safe and comfortable.
Perfect. You got it. That shows you understand the nuances of patient care.
Okay. And I'm guessing just saying like, oh yeah, I've done it all is not going to cut it.
No vague answers.
Show, don't tell.
Exactly.
Got it. Okay, next question. This one feels like a real juggling act. How do you prioritize your tasks when caring for multiple patients at once?
Ooh, this is a good one. They're looking for organization and time management.
Yeah, because it's going to be busy.
It's going to be busy.
How do you convince them that you've got this under control?
Walk them through your process.
Okay.
Do you use a mental checklist? Do you prioritize based on urgency? Any specific time management techniques you use? Whatever your method is, explain it clearly and concisely.
So basically show them what your organized mind looks like at work. Got it. So I just wing it is definitely not the right answer here.
Definitely not. You want to project that image of someone who's structured and can handle that pressure.
Makes sense. Now this question feels like a real test of composure. How do you handle difficult patients who may be uncooperative or agitated?
Yeah, they want to see your professionalism and your compassion.
Right.
Even when things get tough. You got to show you can stay calm, de-escalate the situation, and just maintain control.
So how do you strike that balance between being firm but also being empathetic?
Focus on active listening and problem solving. So explain how you'd validate the patient's feelings. Try to understand why they're acting that way. Instead of getting defensive, highlight your ability to stay composed. And don't be afraid to seek assistance from supervisors when you need it.
That's a good point. It's like showing them you can handle the emotional side of caregiving just as well as you handle the physical tasks.
Absolutely.
Now, what are some things you should never, ever say when answering this question?
Don't get sucked into their negativity. So avoid phrases like, I would get frustrated, or I would just tell them to calm down. You want to showcase your ability to manage the situation proactively.
Right. It's about being a problem solver, not adding to the problem.
Exactly.
And this is where RoleCatcher's AI tools can be really helpful.
Yeah.
They can analyze those job descriptions and point out keywords like patience and composure.
Which are super important.
So important.
Yeah.
So you can tailor your answers to really hit the mark.
Right. For example, if the job description specifically mentions experience with dementia patients, you can weave in those specific examples of how you've handled challenging behaviors with compassion and respect.
That's so smart. Okay, are you ready for the next question?
Bring it on. All right, so let's keep going with those interview questions.
Okay.
We're going to dive into some scenarios that really test your judgment and your ability to think on your feet.
Okay, our listeners are ready. Bring it on.
All right, imagine this. You're in the interview and they ask you, what would you do if you noticed a coworker engaging in unsafe practices?
Ooh, that's a tough one. You don't want to be a tattletale,
Yeah.
but patient safety is a top priority.
Right. It's a tough one. So it's all about showing your professionalism and your commitment to providing quality care. So start by emphasizing that patient well-being is paramount.
Okay.
Make it clear that your priority is a safe environment for everybody.
Okay, so you set the stage. Now, how do you actually address this situation?
Lay out a clear plan of action. You could say something like, I would first try to address the issue directly with my coworker, explaining my concerns and emphasizing the potential risks.
Okay, that shows you're a team player.
Exactly.
But what if the behavior continues? Do you just let it slide?
Absolutely not. If those unsafe practices are still happening, you need to escalate the issue to a supervisor.
Okay.
Follow the appropriate chain of command.
So it's about knowing when to involve the higher-ups.
Exactly.
Are there any, common pitfalls to avoid when you're answering this question?
Yeah, don't just blurt out, I'd report them immediately. While reporting unsafe practices is essential, it's important to show that you tried to resolve the issue directly first. Demonstrate those problem-solving skills and your ability to handle those interpersonal dynamics.
Makes sense. Okay, let's switch gears to a different scenario. What would you do if a patient refused a treatment or a procedure?
This is a good one. This question really gets at understanding patient rights and advocating for their wishes, all while ensuring they're safe.
That's a tough balance.
Yeah.
How do you respect their choices while making sure they're getting the care they need?
Start by acknowledging their right to refuse treatment. You could say something like, I would begin by patiently explaining the treatment or procedure, addressing any concerns or misconceptions the patient might have, and I would make sure to emphasize the potential benefits and risks of refusing that treatment.
Okay, that sounds like a good starting point. But what if, despite your best efforts, they still say no?
Then it's crucial to document that refusal and inform the nursing staff.
Okay.
That ensures the patient's decision is respected, and the medical record accurately reflects their wishes.
So it's all about clear communication.
Exactly.
Making sure everyone's in the loop.
Yes.
What are some things you should avoid saying when responding to this type of question?
Don't say anything that sounds like you're forcing the treatment.
Okay.
So avoid phrases like, I'd tell them they have to do it, or I'd try to convince them to change their mind.
Right.
You want to show that you respect patient autonomy.
Got it. Okay. Get ready for a curveball. What would you do if you found a patient unresponsive? This one feels like it's all about quick thinking and knowing those emergency protocols.
Absolutely. They want to assess your knowledge of basic life support and how you stay calm and act quickly in a crisis.
So how do you show them that you're ready for anything?
Start by highlighting your training and certifications in basic life support. Emphasize your ability to assess the situation quickly and follow those established protocols.
Can you give us an example of a strong answer?
Sure. You could say something like, I would immediately check for a pulse and breathing. If absent, I would initiate CPR while calling for assistance, continuing to follow the established protocols until medical professionals arrived.
Okay, so clear confidence shows you know exactly what to do.
Exactly.
Now, what about things to avoid saying when you're talking about emergencies?
Never say things like, I'd freak out or I wouldn't know what to do.
Right.
Even if you're feeling nervous, project a sense of calm and capability. You want to showcase your ability to handle a crisis effectively.
Okay. Makes sense. Shifting gears a bit, let's talk teamwork. How do you handle conflict between coworkers?
This is a big one. They want to see if you can resolve conflicts constructively and maintain that positive work environment.
Teamwork is so important in healthcare.
So important. So your ability to collaborate effectively is key.
How do you approach this question without bad-mouthing your former colleagues or coming across as overly sensitive?
It's about focusing on your communication and problem-solving skills. Highlight your ability to remain neutral. Listen actively to all sides and try to find that common ground.
Can you give an example of a strong response that really highlights those skills?
Of course, you could say, I would first try to understand the perspectives of both coworkers involved, encouraging open communication and respectful dialogue. Then I'd focus on finding a solution that addresses the needs of both parties, all while prioritizing patient care.
So it's a diplomatic approach.
Exactly.
What are some things to steer clear of when discussing coworker conflicts?
Don't take sides.
Okay.
Avoid statements like, I always agree with my friends, or I'd stay out of it. You want to show you can handle conflicts fairly and professionally, even when it involves your close colleagues.
Got it. Okay. This brings us to a classic interview question. What are your strengths and weaknesses as a nurse assistant? How do you make this answer work for you?
It's a classic for a reason. It's a chance for you to really shine when discussing your strengths. Focus on qualities that are directly relevant to the role.
Okay.
Think about things like compassion, patience, attention to detail, strong communication skills.
Those are all good.
And don't just list them. Back them up with concrete examples from your experience.
So show, don't tell again.
Exactly.
But what about weaknesses? Everyone has them. How do you talk about those without sabotaging your chances?
Be honest, but be strategic. Choose a weakness that's relatively minor and something that you're actively working to improve. Explain how you're addressing it.
Okay.
This shows self-awareness and a commitment to personal growth.
Can you give us an example?
Sure, someone might say, sometimes I can be a bit too focused on completing tasks quickly, which can occasionally lead to oversights.
Yeah.
To address this, I'm consciously slowing down and double-checking my work, ensuring I'm maintaining both efficiency and accuracy.
So it's turning that potential negative into a positive.
Exactly.
I love that.
Yeah.
Okay, before we move on, I want to circle back to RoleCatcher's AI features. We've talked about how it can analyze job descriptions and help you practice answers, but is there anything else it can do?
There's more. Remember how the career guide mentioned the importance of certifications?
Yes.
Well, RoleCatcher's AI can actually help you figure out which certifications are most valuable for the jobs you're applying for.
So instead of just like randomly getting a bunch of certifications, I can use RoleCatcher to be strategic about it.
Exactly. It's about focusing your efforts on the certifications that will make a difference to employers.
That's amazing.
Okay.
Now, I know we've covered a ton of ground here, but before we wrap up this section, I want to touch on career advancement. RoleCatcher's career guide has some really interesting insights about building a long-term career as a nurse assistant.
It does. It outlines different career stages, starting with the entry-level role and moving up to experienced and senior positions.
So what are some of the key differences between those stages?
At the entry level, you're going to be providing that basic patient care under close supervision. Think of it as building your foundation. Then as you gain experience, you move into that experience stage. You'll take on more responsibilities, maybe assisting with more complex procedures or mentoring newer assistants.
Okay, and what about that senior nurse assistant role? What sets that apart?
Senior nurse assistants often take on more leadership responsibilities. They might supervise and delegate tasks to other assistants, play a bigger part in developing care plans, or even take part in quality improvement initiatives.
So there's definitely room for growth in this field.
Absolutely.
What can someone do to like boost their career prospects and move up that ladder?
Continuous learning is key. The career guide really emphasizes staying up to date on medical advancements, attending workshops, pursuing additional certifications. You could even consider further education to become a licensed practical nurse or a registered nurse.
Wow, so many options. Okay, are you ready to tackle the last set of interview questions? I know our listeners are eager to hear your insights.
Let's do it. All right, so let's wrap up with some questions that really dig into what makes a great caregiver. You know, the ones that go beyond skills and experience and tap into those values and motivations.
Ooh, okay, I'm intrigued. What kind of questions are we talking about?
Well, think about this one. Why did you choose a career as a nurse assistant? It might seem simple, but it says a lot about your passion for this field.
Ah, the classic why this job question.
Right. It's your chance to show them what really drives you.
So how do you answer authentically? You know, without sounding like you're just reciting a script.
This is where those personal stories really shine.
Okay.
Were you inspired by a family member in healthcare? Do you have a personal connection to the patient population you'll be serving? Share those experiences because they make your answer unique and memorable.
So, for example, if I was applying to a pediatric ward, I could talk about my time volunteering at a children's hospital.
Exactly. That personal touch really makes a difference.
What are some things to avoid when you're answering this question? Like what would make interviewer kind of raise an eyebrow?
Don't just focus on the practical stuff like job security or salary. Those are valid considerations, but they shouldn't be the only reasons you're choosing this career, especially in healthcare.
Right, it's about showing them you're in it for the right reasons. Okay, so what other insightful questions should our listeners be prepared for?
Here's one that gets to the core of caregiving. What does compassionate care mean to you?
Ooh, that's a good one. It's not about the textbook definition, right? It's about your personal approach.
Exactly. They want to see if you understand the emotional and psychological side of caregiving. It's about recognizing that each patient is an individual with their own needs and fears.
So how do you explain something as personal as compassion in a way that really resonates?
Think about what compassionate care looks like in action. Maybe it's taking the time to listen to a patient's worries or offering words of encouragement, or even something as simple as holding their hand during a tough time.
Those little things can mean so much.
They really do.
Any pitfalls to avoid with this one?
Yeah, don't just give a generic definition of compassion. Really go deeper. Share specific actions, describe behaviors that show your understanding of this core value.
Got it. Show, don't tell. All right, what about this question? What are your expectations for this role? Seems pretty straightforward, but I feel like there's more to it than meets the eye.
You're right. This question is all about alignment. Making sure your expectations match up with what the job actually entails. It's also a chance for you to show that you've done your homework and you understand what being a nurse assistant is really all about.
So how do you strike that balance between, showing your excitement for the job, but also being realistic about the challenges?
You want to highlight both the rewards and the demands. You could say something like, I expect this role to be both challenging and rewarding. I'm eager to make a positive impact on patients' lives, but I also understand it requires hard work, patience, and resilience.
That's a good point. You got to be prepared for the ups and downs.
Definitely.
What are some common mistakes people make when they're talking about their expectations?
Avoid those unrealistic expectations.
Okay.
So don't say things like, I expect to get promoted quickly, or I won't have to do any of the unpleasant tasks.
Right.
Be grounded in the realities of the role and demonstrate that you're ready for those demands.
Got it. Okay, before we wrap things up, I want to loop back to RoleCatcher's AI features one last time.
Okay.
We talked about resumes and practice answers, but is there anything else it can do to help our listeners land that dream job?
Actually, there is one more thing. Remember how the career guide mentioned the importance of certifications?
Yeah.
Well, RoleCatcher's AI can actually analyze job descriptions and tell you which certifications are the most valuable.
Wow. So it's like taking the guesswork out of the whole process.
Exactly. It helps you focus on the certifications that will really impress potential employers.
That's incredible. Now, as we're wrapping up this deep dive into nurse assistant interview prep, I want to leave our listeners with a final thought to consider.
Yeah.
It's inspired by something that's really emphasized throughout all of RoleCatcher's resources, the importance of culturally competent care.
Oh, that's so important.
As you're embarking on this journey, take some time to think about what that means to you and how you'll show it in your interactions with patients from all different backgrounds.
Compassion, respect, understanding. Those are at the heart of providing quality care for everyone.
And to our listeners, don't forget to check out RoleCatcher's website for more in-depth guidance on career exploration, interview skills, and so much more. They have a ton of information to support you on this path.
We wish you the best of luck in your interviews. Remember, preparation is key. With the right tools and the right mindset, you can confidently showcase your skills and passion for this really rewarding career.
Thanks for joining us on this deep dive. We'll see you next time for another exciting exploration of a fascinating career path.